Hello, this is MedTech Training. So first off, I want to say thank you and welcome to our family. If you're receiving this training, we have the most confidence that you have what it takes to be part of a great family. Our family, the Damani family. Only a select few, though, can be our full-time med techs. So if you're one of the select who's going to be a full-time med tech, congratulations. All others, med tech training is still a basic caregiver training that you need to know in the event that you need to help out with a medication pass. First video is going to be on how to apply a mask. With COVID-19, masks have become an everyday part of our lives. However, many of us don't know how to properly handle a mask. This is an extremely important step to protect yourself and your residents. So if there is a COVID outbreak in your building, it's important for you to know how to handle your mask to keep yourself from getting sick. So we are going to jump into our first video.
Hey everyone, it's Sarah, registered nurse, RN.com, and in this video I'm going to demonstrate how to wear and take off a mask. First, let's talk about some of the common mistakes that people make whenever wearing a mask like this. One common mistake that people make is that when they wear the mask, they will wear it under the nose. Another common mistake is that people will fail to seal the top of the mask around the nose and cheeks. In addition, people will sometimes fail to pull the mask under the chin. People also wear the mask upside down or backwards. And finally, while wearing the mask, people will sometimes touch the front of the mask, which is considered contaminated. Now let me give you some tips on how to wear the mask. So first, you need to determine which part actually goes over your nose, this part or that part. So to do that, what you want to do is you want to feel along those edges. And what you're feeling for is like a metal type band that's sewn into the mask that's easily flexible, that can fit over your nose, and that's the top part. Next, what you want to do is you want to determine which part of the mask is the front versus the back. And there's two ways you can do this. And if you're using a mask with ear loops, you can look at the ear loops, and where they are sewn at, this will be the area that goes on the face. So on this mask, they're sewn here, so this is the part that goes over my face. Also, you can look at the pleats of the mask and look at how they are pointing. When the pleats are pointing downward, this is the part that goes on the outside, versus the pleats that are pointing upward, that's the part that's going to touch your face. Before we put on a mask, we want to perform hand hygiene. When using a face mask with ear loops, place each loop over the ears. Then grasp the nose piece of the mask and bring it to cover the bridge of the nose. Then mold the nose piece of the face mask with the fingertips of both hands by starting at the bridge of the nose and work outward toward the cheekbone. Then grasp the nose piece of the face mask and pull the bottom of the mask under the chin. When removing the mask, it's important to remember that the front of the mask is considered contaminated. Therefore, grasp the ear loops of the mask with the fingertips and remove from the face. Dispose or clean and store for future use the mask per facility's protocol, and then perform hand hygiene. Okay, so that wraps up this video on how to wear and take off a mask. And don't forget to check out the other videos in this. Hey everyone.
So with our mask, it's also important to know that if we are in a COVID situation within the building, that we dispose of our mask at the end of the day, that we don't reuse that mask outside of the building, just because we don't know if those particles might become dislodged and in the air for others around us to breathe. Also, if there is a true outbreak of COVID-19, all employees, if available, should be wearing the N95 mask. These masks are going to provide a higher grade of protection against any airborne viruses. So, the most important step we can always do in providing great care to our residents is we wear our mask in all resident care areas. This means that we do not take our mask off for any reason, and that we don't, wear the mask improperly. This is the best way to protect them and yourself from the COVID-19 variant. This is also extremely important because we have to put their safety first. If you're found without your mask in any of the resident care areas, you will receive a write-up. This is because we take and bring viruses into our residents. And for us, we might be able to fight it off. But for them, colds and flus and other things that are airborne could prove to be deadly. Secondly, if the state was to walk in and see an employee in a resident care area providing resident care without a mask, Del Monte could face a potential citation from the state. So please help us to remain in compliance with our state licensing boards. So the next video is going to be on medication errors. With medication errors, please just keep in mind that yes, sometimes medication errors can happen. However, it's extremely important to report them in on time and to, let us know what medications were given in a quick and timely manner. So here we go.
1999, the Institute of Medicine published a report called "To Err is Human." It made headlines across the country because it revealed a shocking national problem. As many as 98,000 people were dying every year from medical mistakes, more than from motor vehicle accidents, breast cancer, or AIDS. This landmark report ignited a national quest to find ways to make American healthcare safer. In 2008, researchers interviewed 7,500 people who had at least one chronic illness. The study group was drawn from 8 different countries, including Australia, Canada, France, Germany, the Netherlands, New Zealand, the United Kingdom, and the United States. Can you guess which country's patients reported the most medical errors? If you chose the U.S., you are correct. A third of the Americans in the study said they had been personally touched by some kind of medical error. Clearly, we still have a long way to go in preventing medical errors, but this is a problem that we can solve. Even the report that first alerted us to the crisis points out that to err is human, but errors can be prevented. And to that end, every physician, every pharmacist, every nurse, and every patient has a role to play. Hello, and welcome to Preventing Medical Errors. I'm Len Jennings, and I'll be your host for this 2-part program. Both video sessions will focus specifically on medication errors. Our goal is to promote safe drug administration by both medical personnel and lay people. Part 1 of this video will furnish you with current information to answer 4 important questions. Why do medication errors occur? What types of medication errors can occur? And which patients could be most harmed by them? How can medication errors be prevented? And what can nurses do to educate patients and families about preventing medication errors? In Part 2 of the video, we'll look at the basics of safe medication administration. Okay, let's get started. The first question we want to answer is, why do medication errors occur? Before we consider this question, however, let's first define what a medication error is. The National Coordinating Council for Medication Error Reporting and Prevention, or NCC-MERP, defines a medication error as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Notice that a medication error is, by definition, a preventable event. Another name for a medication error is a preventable adverse drug event, or ADE. The National Institute of Medicine believes that at least 1.5 million preventable ADEs occur in the United States every year. As staggering as these numbers are, keep in mind that these errors are preventable. As a nurse, you play a key role in preventing medication errors. Because your job requires you to administer medications directly to patients, you are often the final link in the medication administration chain. You are also in a unique position to advocate for your patients. In addition, you are often the key educator of others who will continue to administer medications after the patient leaves your care. For all of these reasons, it is very important for you to know the answer to our question: why do medication errors occur? There are many reasons for medication errors. The Food and Drug Administration, or FDA, cites that medication errors usually occur because of multiple complex factors, and that both healthcare professionals and patients have a role in preventing them. The Agency for Healthcare Research and Quality, or AHRQ, has found that most of the time, errors don't result from a single person's mistake or misconduct. Far more often, they say, errors are caused by factors within the healthcare delivery system or by the way resources are provided within the system. The American Hospital Association cites 5 common reasons for medication errors. 1. Medication errors can occur if providers have incomplete patient information. Providers may not know about patients' allergies, the other medicines they are taking, previous diagnosis, or lab results. 2. Medication errors may also occur if drug information is unavailable. For example, up-to-date warnings may be unavailable. 3. A third reason for medication errors is miscommunication of drug orders. This can involve poor handwriting, confusion between drugs with similar names, misuse of zeros and decimal points, confusion of metric and other dosing units, and inappropriate abbreviations. 4. The lack of appropriate labeling as a drug is prepared and repackaged into smaller units can result in errors. 5. Finally, environmental factors can cause medication errors. Heat, noise, inadequate lighting, or interruptions can distract health professionals from their work. To look at this issue another way, all of the things that contribute to medication errors can be grouped into 3 categories. That is, medication errors are caused by human factors, manufacturing issues, or institutional culture or system factors. Human factors include both oral and written communication. Language barriers, literacy, misinterpreting an order, transcription errors, and miscalculation of dosage all fall under this category. Manufacturing issues include product labeling, packaging, package inserts, and printed and electronic reference materials. Product names that sound alike or look alike can be easily confused. For example, Xanax, an anti-anxiety drug, can be confused with Zantac, a gastric acid inhibitor. Celebrex, an NSAID, can be confused with Celexa, an antidepressant. Potent intravenous solutions and high-alert drugs are of special concern. The safe administration of these types of medications can be dangerously compromised by routine labeling and packaging, by confusing drug names, or by inadequate reference materials. Ideally, an institution's culture and internal system should create a climate where it is easier to do things right than to do them wrong. Many organizations are moving away from a focus on who is the problem to a focus on what is the problem. Interestingly, NCC MERP says that organizations that provide incentives and resources for reporting medication errors are likely to report more errors than organizations with a non-supportive culture. Such transparency can pave the way for better staff education, improved medication administration policies and procedures, more timely access to patient information, and better reporting and review policies. Organizational deficiencies that affect medication systems can relate to information, environment, and human resources. Fortunately, all can be addressed and improved. Information is a key factor that affects the safe administration of medications. Organizations must provide access to information for everyone involved in any part of the medication administration process. Technology can be a great help. Information can be disseminated via an organization's intranet, as well as through newsletters, videos, and staff meetings. Environment can be defined in terms of where and how drugs are stored, the effectiveness of temperature controls, the workflow for handling drugs, and the handoff of drugs from one staff member to another. Human resource policies must address the reality that people can't perform at an optimal level when they are exhausted or stressed. Policies have bearing on medication administration safety. Policy issues include staffing patterns, the number of continuous 12-hour shifts allowed for nurses, and the organization's mandatory overtime policy. Let's continue on to discuss what types of medication errors can occur and which patients could be most harmed by them. In 1996, the NCC-MERP developed the Index for Categorizing Medication Errors. The index was originally adopted to classify errors according to the severity of the outcome, and it listed errors in descending order. Its purpose was to help healthcare professionals track medication errors in a systematic way. 5 years later, in 2001, the index was revised to portray the 9 different medication error categories differently. The 9 categories are now identified by the letters A through I and are represented equally in a circular chart. The circle was chosen to emphasize that all medication errors, even potential errors, are regarded with equal importance. The chart classifies errors according to the amount of harm done. The 9 categories of medication errors are grouped according to 4 classifications of error and harm. Group 1, no error has occurred. Category A, circumstances or events that have the capacity to cause error. In Group 2, error has occurred, but no harm is done. Group 2 includes categories B through D. Category B, an error occurred, but the error did not reach the patient. Category C, an error occurred that reached the patient but did not cause the patient harm. Category D, an error occurred that reached the patient and required monitoring to confirm that it resulted in no harm to the patient and or required intervention to preclude harm. In Group 3, an error has occurred and harm was done. Group 3 includes categories E through H. Category E, an error occurred that may have contributed to or resulted in temporary harm to the patient and required intervention. Category F, an error occurred that may have contributed to or resulted in temporary harm to the patient and required initial or prolonged hospitalization. Category G, an error occurred that may have contributed to or resulted in permanent patient harm. Category H, an error occurred that required intervention necessary to sustain life. In Group 4, an error has occurred and resulted in death. Category I, an error occurred that may have contributed to or resulted in the patient's death. Let's put this information to the test. Study the index for categorizing medication errors as you consider this case study from the December 2008 issue of Urologic Nursing.
A 56-year-old female with hyperkalemia was in a medical intensive care unit and was ordered to receive sodium polystyrene sulfonate via rectal administration. The registered nurse caring for this patient inadvertently administered the medication through the urinary or Foley catheter instead of the rectal tube. The patient developed cystitis because of the error, which required a consult by urology to determine treatment options.
Which category does this error belong in? If you chose category E, you are correct. Category E is the appropriate choice because the patient had temporary harm, cystitis, directly resulting from the medication error, instilling medication into the bladder instead of the rectum. The cystitis required intervention. Now let's look at another case study from a 2005 issue of Hospital Pharmacy. Study the index for categorizing medication errors as you consider this case study.
A facility pharmacy typically dispensed each patient's chemotherapy inside a labeled Ziploc bag, which was then taken to the bedside for verification before administration. In this case, the pharmacy sent chemotherapy for 2 different patients inside the same Ziploc bag. Both were the same drug, but different doses. The verification process proceeded, as usual, by taking the Ziploc bag to the patient's room. The contents of the bag were removed, at which time the nurses discovered that there were 2 chemotherapy bags for different patients. They verified the patient and the medication using 2 unique identifiers, but the nurse who then administered the chemotherapy accidentally picked up the wrong patient's bag and hung it. The other bag of chemotherapy was placed back in the Ziploc bag and returned to the medication room. Hours later, the error was discovered while looking for chemotherapy for the other patient. Luckily, the 2 patients' doses were close enough that no harm resulted.
Which category does this medication error belong in? If you chose category C, you are correct. An error occurred that reached both patients, but no harm was done to either patient. Now that we have seen an overview of the types of medication errors that can occur, let's turn our attention to the other issue. Which patients could be most harmed by them? Stated simply, the answer to this question is 2 high-risk populations, the very young and the very old. Children are more sensitive to medications because of their smaller size and some differences in their anatomy. Children also have a higher metabolic rate, so they absorb and excrete medications more quickly. Their faster absorption can cause reactions to occur more quickly than in adults. Also, children may not be aware that they are having a problem with the medication, or if they are aware, they may be unable to communicate their distress. Children are also more likely than adults to have an unusual reaction to a drug. These concerns make it even more important for nurses to be very familiar with the effects of the drugs they administer and to be very alert to children's responses following administration. The elderly also require special consideration when administering medications. Older adults are more likely than any other age group to have an adverse drug event, or ADE. This may be partly because they are exposed to a greater number of medications. Nearly 90% of those 65 years of age or older take at least one medication, significantly more than any other age group. In addition, as we age, all body systems begin to slow and secretions begin to decrease. This alters pharmacokinetics values, resulting in heightened sensitivity to many drugs. A third issue is non-compliance with drug therapy. This may occur due to a misunderstanding, poor judgment, declining memory, or declining physical capabilities. As with children, close observation of and response to elderly patients' reactions to medications is vital. In addition, since the elderly process information at a slower pace, present medication information to them slowly. If time permits, go over the information a second time. Let's turn our attention now to our third question. How can medication errors be prevented? Reporting medical errors is important. After all, only when a problem and the circumstances surrounding it are identified can the problem be addressed. The more medication errors are reported and scrutinized, the better the chances become for devising effective ways to prevent future errors. Everyone involved with patient care has a responsibility to report all medication errors. Pharmacists, physicians, nurses, respiratory therapists, patients, and families often report errors at the ground level to the appropriate healthcare institution through the proper channels. Increasingly, healthcare providers and consumers are reporting medication errors directly to the Food and Drug Administration. You can report information to the FDA via their secure online reporting form, or reports can be made by phone. You may be wondering, besides reporting errors, what else can I do? In its 2006 report, Preventing Medication Errors, the Institute of Medicine outlined recommendations for dramatically reducing medical errors. One recommendation was to move toward a healthcare model that partners more with patients, educating them, consulting with them, and listening to them. The Institute of Medicine recommendation brings us to our final question.
So with medication errors, the most important thing that we can do in preventing errors is to perform all 6 rights in medication, which we're going to go over here in the next couple of slides. It's also important to slow down and take our time, especially as we are learning. We are not expecting you guys to fly through this and be perfect. The most important thing I can stress to you guys is I would rather hear a medication was given late, not extremely late, but 20-30 minutes late, versus a medication error had occurred, such as potentially giving a medication to someone that you thought was the other resident. We don't know what kind of effect it will have on that resident if they were to receive somebody else's medication, and unfortunately it could be deadly for them. During this class, you're probably wondering what is going to be covered. Keep in mind that you're going to have on-the-floor training as well. The main components of this class are going to be the 6 rights of medication administration, so the right resident, the right medication, the right dose, the right route, the right time, and the right documentation. Then we're going to go over communication, delegation, and preparation. So understanding tools for communication, understanding what you're able to do and what you could potentially pass on to another caregiver, and then time to prepare for your shift. So meaning that we're coming to work on time, we are not socializing when we should be doing medication counts, and when we should be prepping our cart to go onto the floor for our med passes. And then we're going to go into medication preparation and administration. So how to read a chart and a MAR before we start pulling medications. How to safely handle those medications once we do start pulling the medications from the cart or overflow. And how to safely administer them to the residents. There are several different routes, and some medications do have special ways that they need to be given in order to be given safely. Then we're going to go into safe storage. So handling our med cart, making sure we know how to lock it, how to handle our overflow, and how to maneuver our way in the medication room. This component, you guys are going to get a lot of on the floor practice with an experienced med tech or a director of nurses to make sure you guys understand how all of those steps are done. And then we are actually going to dig deeper into the medication administration record, also known as a MAR. And then we're going to talk about the most common medication errors and how to avoid the mistakes. Hopefully these medication errors that we're going to go over, you're not going to make. But however, if you're aware that they are potential mistakes, this could help you avoid them. So our next video is going to be over the 6 rights. The 6 rights of medication are the most important steps that we can take for providing care to our residents while passing out medications.
Administration guidelines that medication aides should know and follow. Some clients have conditional restrictions regarding their medications. For example, certain medications may not be given if the client's blood pressure or pulse is too low. Always check the MAR to determine if any of your clients have restrictions that you need to be aware of before administering their medications. Your agency will direct you on how to handle these situations. Protect your client's dignity by respecting their privacy. By law, you must protect the privacy and confidentiality of your client by not allowing visitors or other clients to know what medication your client is taking. When administering medications, especially topical, vaginal, or rectal, provide privacy for your client by shielding them from others with a curtain or door and by covering them when necessary. Stay focused. Once you begin administering medications, do not stop unless there is a life-threatening emergency that demands your attention. If you must leave the medication cart, remember to lock it. Avoid giving medications in public places, such as dining rooms or hallways. The chance of making an error increases in these kinds of environments because it is easy to get distracted and make errors. Let's review the key points of medication administration. As a medication aid, you should always prepare your workspace and gather your supplies so that you can stay focused on the task of medication administration once you begin. Protect your client's privacy. You are required by law to keep their personal health information confidential. Practice proper hand hygiene at all times to protect your clients and yourself. Always refer to the Medication Administration Record, or MAR, when administering medications. Never give medications from memory. Always follow the 6 rights of medication administration. Remember, following the 6 rights means that every time you give medications, you are making sure you have the right client. Give the right medication. Give the right dose. Use the right route. Give the medication at the right time and provide the right documentation. Following these guidelines and practicing the 6 rights will help ensure safe and accurate medication administration for your clients.
So if we perform the 6 rights of medication administration, every time we prepare a medication, hand a medication out, our chances of an error dramatically decrease. So we're going to review this again. This might sound like a broken record throughout this training, but however, these are extremely, extremely important. And the number one that most of the time when a medication error occurs is going to be with the right resident. So make sure every single time you identify your resident, you ask them their name, you look at the MAR book, and you compare picture if needed. We do have pictures of our residents just in case they cannot properly tell you their name, their room number, or their date of birth, or any other identifying factors to help make sure you have the right resident. If you're in doubt, please ask somebody else on staff. We understand that many of our med techs have not worked the floor as caregivers, and you're not necessarily going to know all of the residents. So please, in doubt, ask someone else to help you properly identify our resident. Then we have the right medication. So we're going to perform 3 checks when we're, preparing the medication. When we're pulling it from the cart, we're going to read the label. We're going to look at the order, and we're going to look at the MAR. Now, during these 3 checks, As time goes on, the 3 checks are going to be second nature. They're going to be very quick for you, and you're going to be performing 3 checks and not even realizing you're performing 3 checks. The right dosage. Compare dosages against the MAR or the order. If all of a sudden you're, pulling out a medication and you realize, I normally give Mrs. Smith 1 tablet and now the label on the prescription bottle says 2, go back and compare your MAR and your order. Also, it's extremely important as med techs that we have great communication with our other counterparts that are coming on and leaving our shifts, that we pass along this type of communication, that we should be doing a nice warm handoff. Hi, Susie. Just so you know, Mrs. Smith in room 3, she went and saw her doctor today. Instead of getting 1 trazodone tonight for bed, the order has been changed and she will be receiving 2 tablets. So make sure that you guys are having that communication so that way when you're looking at dosages and changes in orders, you're on the right track. On the right route. This is also something that can very easily happen, especially when we're dealing with eye drops or ear drops. So you're going to want to read the label, look at the MAR, and look at that order. And if you're ever in doubt, call your supervisor, call the prescribing physician, call the pharmacy. So when it comes to medications that can be accidentally instilled in the wrong body surface, we want to take those medications into the rooms one at a time. So example, Mrs. Smith has developed a severe sinus infection and that has created an infection within her eyes, an infection within her ears, and her prescriber has now prescribed eye drops and ear drops. So we are going to take the eye drops and the ear drops in separately. We're going to take one of those medications in at a time because we could accidentally pick up the ear drops and instill them into the eyes, and that could cause damage to her sight. So when we're dealing with medications like that, you're going to want to take those in one at a time to help avoid errors. The right time, making sure medications are given within the 2-hour window of the time of the day. So for medications that are due at 8 p.m., we can start our med pass at 7 p.m. to 9 p.m. So when we say a 2-hour window, we're talking about a 1 hour before or 1 hour after the time that it's due to be given. Another thing to kind of keep in mind with the right time, and I know this can happen when we think we're being helpful, is like our diabetics. If you have a diabetic whose insulin is due in the morning and it's only due once a day, and it's now 12 o'clock at night and your residents' insulin levels seem not to be working because they're at 300 and something, please, 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 please do not give them another round of insulin if it is not ordered. Keyword here is not ordered, or if it is not the correct time of the day. So for example, Lantus. Lantus is normally given once a day, usually in the mornings. It's a longer acting insulin. If you give the insulin at bedtime because the resident's sugar levels are high, it is actually not going to have any effect on the resident's sugar levels for approximately 6 to 12 hours later. And so you could cause harm sending them in the opposite direction of a low glucose level, and that could be potentially dangerous as well. So in those situations, call your supervisor, call the pharmacist, call the physician to get a new order, and never, ever take a verbal order. If you call your doctor and say, Mrs. Smith, her blood sugars are 350, she normally gets Novolog just once in the morning, and the doctor says, okay, go ahead and please administer 2 more units. Do not give those 2 units until you have a faxed back written order with clear directions on exactly what to perform within that medication pass. If you do not receive a fax back, You might have to send that resident out to the hospital if their sugar levels are extremely high, but do not ever take a medication order verbally. We are not a licensed clinical staff such as an LVNs or RNs. So make sure you're following that as well when you're looking at the right time if you have to get a new medication order. Write documentation. If it's not documented, it didn't happen. We want to make sure that we are documenting within the MAR. And what this means is that we are signing our MAR book as we are as we are handing out our medications, not as we are pouring. Sometimes med techs think, it's just going to be easier for me to stand here and sign my MAR book for everybody and then go up to the floor and pour. And what can happen is that you can think you've given a medication to somebody, but in reality, maybe you didn't. Maybe they weren't in their room. Maybe you didn't realize they were out on a leave. And you're going to come back and you're going to think, oh, I passed all my meds because all my spots are signed. So you're going to want to do the right documentation. So signing the MAR book as you're physically handling these medications to the resident. And if the resident's refusing, you're going to circle it and you're going to go back to their chart and you're going to document, right, documentation. You're going to document why they refuse that medication. Maybe it was a medication that they didn't want to take in the first place and their physician ordered it for them anyways. Maybe it's a medication that they don't understand why they're taking it. So write documentation. So now we're going to document why they're not taking it. Right documentation also includes if there is a reaction. So if Mrs. Smith has taken a new medication, develops a rash, we're going to do the right documentation to show that she's had a reaction and that we've called our provider. So right documentation. So our triple check. So triple check, as mentioned earlier, you're going to start doing this and it's going to be second nature and you're going to think, wow, I remember when I used to do triple check, it seemed like it took forever. But triple check, every time you perform these three check system, you should be looking, at the medication when you're removing it from the med cart, and you should be checking it against the prescription label and the MAR. So you're like you saw in the video, they're looking at the med, they're reading the MAR, and they're comparing. And when you're doing that, you're also looking for the right name, the right medication, the right dose, and the right route. If the order on the MAR and the label and the order itself do not match anywhere, stop what you're doing and check with a supervisor, because you want to make sure that there's not an error in any of the three. So the second check is going to be before you're pouring the medication, you're going to check it against the medication log. You're going to make sure the name matches again. You're going to look at the dosage and the route and the time. So the third check is that you're going to pour the medication, but before giving it, you're going to check the prescription label against the order, and you're going to make sure the order is right with the log and the MAR, and you're going to make sure the right route, name, dosage, all of that is going again. So every time you're pouring a medication, pulling a medication, you're going to be checking all three areas. So as mentioned earlier, the right resident. I cannot stress this enough. You want to make sure you have the right resident. So in order to make sure you're going to administer a medication to the right resident, you must be able to identify your resident. Compare the individual's name on the prescription label and the medication order and the medication log to make sure they all match. Ask the resident, what is their name? And if they're alert enough, ask them what their date of birth is. The reason why we want to do this is because sometimes we might have a resident who is in the facility and there's another resident, maybe with a similar name or the exact same name. So we always want to see if there's a second identifier that we can use to ensure we have the correct resident. And then, if they don't know their date of birth, maybe they might know their room number. If not, you might want to look at the MAR and identify them by the photo ID. And then once again, if you're in doubt, if you're ever in doubt, ask somebody else on staff. Hey, is this Mrs. Jones, Mrs. Shirley A. Jones, or is this Mrs. Shirley B. Jones? So always check to make sure you have the right resident. The second right is the right medication. So we're going to read that medication label carefully. Some medications have more than one name. So a name brand and a generic. We're going to want to check the spelling of the medication carefully as well, because some medications they can look very similar in the names when we're glancing at them, but the spelling is going to be different. If there's any doubt, please check with somebody. And then read the medication order carefully. Again, make sure the name on the order matches the medication label that you're getting ready to hand out. When it comes to the right medication, we cannot stress this step enough. Read the medication log carefully. So slow down, take your time, and read carefully. Be free of distractions. Read the medication log to make sure that it is the name on the label is the same as the name on the log. Make sure it all matches. So you're performing that triple check. Look at the medication after you have poured it. Is there anything different about the size, the shape, or the color of the medication? So, as time marches on, you're going to know what your residents get. And if you're popping a pill, if you're pouring it, whatever the case might be, and something doesn't look right, call the pharmacist before you give it. It could be that the medication is now a generic brand versus a name brand, or it could mean that you have the wrong medications. Sometimes pharmacies do make mistakes and put a label on the wrong bottle. So that's why you want to make sure, if you notice something different, that you're just double checking. The other thing, if you're, given a medication and maybe the medication has gone old, for example, I'm sure we all remember that amoxicillin with the bubblegum flavor when we were little, when we get ear infection or something. It's pretty thick to begin with, but if it's past its expiration date, it gets really thick in consistency. So a change in color, a change in odor in the medication can many times alert us that the medication is old. So once again, you're going to want to call the pharmacist to just verify that the medication is still safe if the label says it's within its dates. And if anything does not match the MAR, the order, the label, even if it's off, let's say the MAR says it should be 5 milligrams and the order says it should be 5 milligrams, but the bottle says it's 10 milligrams, stop what you're doing. Call the pharmacy and let them know. Also, double check with the provider. Okay, medication types. So this next video is going to go over all the different medication types that you're going to see out there and the most common ones. So video number 3.
Some pills require that they be crushed or cut in half. Some pills are scored with a carved groove, which means it can be cut into 2 equal halves. Wearing gloves, place the tablet in the pill cutter, lining up the groove with the blade. Firmly press down on the cutter until the pill is split. If the pill does not split into 2 equal halves, dispose of them according to your agency's policy and cut another pill. Pills that are not scored are not to be cut because the 2 halves will not have equal doses. When you are finished, clean the pill cutter with an alcohol wipe, being careful not to cut yourself on the blade. Each time you enter the client's space, you must tell them why you are there and which medications they are about to take. You must identify that you have the right client. When administering pills, encourage the client to drink a significant amount of liquids. You must check to see that the client took their medications before you leave. Look into the client's mouth to make certain they swallowed them and are not hiding the pills to avoid taking them. According to the MAR, this particular pill requires crushing. There are several ways to crush a pill, and the technique may vary from agency to agency. Some methods involve using a mortar and pestle. One method is to crush the pill in a paper medication cup. In order to contain the medication in the cup, place a second paper cup on top of the pill. Place the stacked cups inside the mortar and use the pestle to crush the pill into a fine powder. Another way to crush pills is with a levered pill crushing device. Again, place the pill between two paper medication cups. You usually need to hammer the pill several times before the pill is crushed into a fine powder. If the medication comes in an individual package, you can leave it unopened and place the package in the mortar. Use the pestle to crush the pill into a fine powder. You can then open the package and pour the powder from the package. The least preferred way of crushing a pill is to place the pill in a clean mortar and use the pestle to crush the pill directly. Need to use a clean tongue blade to scrape the medication powder from the mortar into the medication cup. The problem with this method is that you lose some of the medication because it adheres to the surface of the mortar and pestle. You must also clean the mortar and pestle before returning them to their storage place. Once the pill is crushed into a fine powder, you can mix it with applesauce or pudding. Use only a small amount of food product because the mixture will taste bitter and it is necessary for the client to eat the entire portion. Always remember to date the food container according to your agency's policy. Some medications require mixing before administering. Metamucil is one example and can be mixed with water or juice. Empty the pre-measured amount of Metamucil into the juice. When using a straw to stir, tear the paper wrapping from the straw so that your hand does not touch the portion of the straw going into the cup or into the client's mouth. Note that Metamucil will turn to gel if it sits too long, so it needs to be given shortly after mixing. Before taking the medications to the client's room, mark your place in the MAR, close the book, and lock the cart. Always introduce yourself when you enter the client's living space. Check that you have the right client. Tell the client why you are there and what medications you are giving them. Unless the MAR indicates a specific sequence, the client can choose which medication to take first. Stay with the client and watch to make sure they take all of their medications. When the client is finished, return immediately to the MAR and document that the medications have been given. Remember to practice good hand hygiene before and after medication administration. If your hands are not visibly soiled, you may cleanse your hands with an alcohol-based hand gel between clients. Always provide the right documentation in the correct space on the MAR after each client has received their medication to avoid errors. When pouring liquid medications, pour them at eye level to get a more accurate measurement. After pouring, set the measuring cup on a level surface to double check you have poured the right dose. If you accidentally pour too much into the medicine cup, simply pour small amounts out into another cup until you get the correct dosage. Never pour liquid medication back into the bottle to prevent contaminating the remaining medication. Remember to perform the 3 checks to avoid giving your client the wrong medication. Always keep the medication cart securely locked when you leave. Before taking the medications to the client's room, mark your place in the MAR. Remember to pour a cup of water for the client to drink with their medications. Identify that you have the right client and tell them why you are there. Sometimes clients find it helpful to wet their mouth with water before taking liquid medications. When you have finished giving medications, cleanse your hands with hand gel or by washing them. Gather the supplies that need to be refrigerated and return them to the refrigerator. Move the locked cart to the agency's designated storage place. Most agencies require the locked cart to remain in a locked storage room to keep it secure when it is not in use.
Okay. So you notice how after each time she handed a medication, she did cleanse her hands. This is important to do in between every single resident because we don't want to take a chance at picking something up and passing it along. So the right medication. So the third right is going to be the right medication. This is how much medication you're supposed to give the individual at one time. And to determine this dosage, you need to know the strength of the medication. In case the liquid medication, you need to know the strength of each measurement in the cc's. So, for example, a 250 milligram strength is 2 cc's, and you need to give you give 500, so 250 times 2 is 500, so 2 cc's. In this example here, I hope you all caught the error. So the error here is what? We're talking about a liquid medication, and the milligram dosages, the mgs, do not match. So the example I just read off to you guys is 250 milligrams and the label says 300. So at this point in time, we would stop passing our medication and we would contact the prescriber and the pharmacy for further instructions or maybe a new order. So if you have any questions in regards to how much medication you're supposed to be handing out and how to do the math, please let your trainer know while you're on the floor. Compare the dose on the medication label to the log and the order. We cannot express this enough. So this next example, you'll notice that our label matches what we're going to be doing. So the strength of each pill is 300 milligram dosage, and we need to be giving 600 twice a day. So 3 milligram times 2 tablets is 600 milligrams. So 300 times 2 is 600. Generally, when we're giving capsules or tablets, you don't see more than 2 given at a time. So if there's more than 2, please double check the order with the pharmacist and the prescriber. The caveat to this rule is maybe with our behavioral health meds, we might then see some of these behavioral health meds where they're getting, more than 2 tablets, such as Seroquel and so forth. But always, if there's more than 2 given at one moment of the same medication, then please double check with the provider. So we are going to stop this section of the video right now. We'll take a quick break, and when we return back, we will go to the right route.